Thanks for staying with us. Cancer is the second most common cause of death in the United States, according to the American Cancer Society. Approximately 610,000 people are expected to die in the United States from cancer this year, which is nearly 1,700 deaths per day.
That's right. News 2's Christina Lobo spoke with a doctor about the difficult decision of turning to other treatment options due to a shortage of chemotherapy drugs.
It's a day-to-day struggle.
Life-saving cancer drugs in short supply.
The demand for cancer unfortunately keeps going.
According to the American Cancer Society, nearly 2 million people in the United States will be diagnosed with cancer this year. About 34,000 of those people live in South Carolina.
Cancer drugs keeps going up as more cancer diagnoses is made, and as the supply is significantly decreased.
Leaving oncologists across the nation, like Dr. Megan Baker, who is the director of Roper St. Francis Healthcare's cancer program, concerned about the consequences if cancer patients can't get chemotherapy.
They really are the drug that made the difference in terms of improved survivability of those cancers.
Those generic medications, carboplatin and cisplatin, cost about $15. The problem? The international supply chain after the FDA shut down one of the vendors in India due to safety and quality control concerns.
That has really triggered a fairly significant shortage of very important generic chemotherapy drugs that in many ways are the backbones of common cancer treatments.
Many medical experts now having to make difficult choices to find solutions to save lives amid the chemo supply shortage.
We've had to give up on some of those side effect preferences, and patients are having to bear that, across our country.
Doctors across the nation worried that some patients may not receive the treatment they need in time.
For example, for the treatment of testicular cancer, you take a 90% survivable cancer rate and you drop it down to 10%. So this is for those patients, if they lose access to these drugs, it really is life and death.
Officials at Roper St. Francis Healthcare tell me they have been able to manage their local shortage effectively and have not had to deny anyone treatment. In downtown Charleston, Christina Lobo, Count on 2.